Hello, my name is Dzul, and I'm presenting my project here today, which is on the predictors of acute radiation dermatitis and esophagitis in African American patients receiving whole breast radiotherapy. This project was done at the Department of Radiation Oncology at the Wayne State University in Detroit. Breast-conserving surgery followed by adjuvant whole breast radiation treatment is standard of care in the management of early stage breast cancer. Two of the most common acute toxicities observed in patients undergoing radiation treatment to the breast are esophagitis and dermatitis. Radiation dermatitis is defined as inflammation of the skin attributed to radiation treatment. It is graded on a 5-point scale provided below. Radiation dermatitis that is at least grade 2 in severity is treated with a topical therapy called Silvadene, which has antimicrobial as well as anti-inflammatory properties. Radiation esophagitis, similar to dermatitis, is inflammation of the esophagus attributed to radiation treatment. It is also graded on a 5-point scale. Symptomatic esophagitis is, by definition, at least grade 2 in severity, and that is treated with a topical mylanta lidocaine mixture, which helps provide patients analgesia. Our institution at Wayne State University is located in Detroit, Michigan. 80% of our patients are African American. African American patients, unfortunately, are more likely to die from breast cancer, with a recent statistics reporting a 40% higher death rate than compared in white Americans. They also have been shown to experience worse acute toxicity during radiation treatment, and unfortunately, African American patients are often underrepresented in major clinical trials, which motivates our study here today, which is a retrospective review on the incidence of radiation dermatitis and esophagitis, specifically in African American patients undergoing adjuvant whole breast radiation treatment. We accrued an institutional database to include all African American patients with a history of breast cancer or DCIS who underwent adjuvant whole breast radiation treatment between 2013 and 2019. We reviewed their medical records to obtain the following information provided on the slide. We then also reviewed the radiation treatment plans to identify breast size, the volume of breast receiving greater than 105% of the prescription dose or 107% of the prescription dose, which is abbreviated V105 and V107%, and the V110%. For the subset of patients who underwent regional nodal irradiation, we reviewed the radiation treatment plans to assess how much radiation was going to the esophagus, and similarly looked at parameters for mean dose to esophagus, max dose to esophagus, and the volume of esophagus receiving a specific dose. We then reviewed patients' prescription history to see which patients were prescribed Silvadene or mylanta during their radiation treatment, and we used that as a surrogate marker to identify which patients were diagnosed with radiation esophagitis or dermatitis at least grade 2 in severity. We subsequently performed a multivariable and univariable logistic regression analysis to identify factors which correlated with the incidence of radiation dermatitis and radiation esophagitis. 272 patients were included in our final analysis. The median age was 59. The majority of patients were either obese or morbidly obese. 40% of the patients underwent hypofractionated radiation treatment. 36% underwent regional nodal irradiation. 22% were treated in the prone position. We had 41% of patients prescribed Silvadene treatment and 7% of patients prescribed mylanta. Here, I've provided the results of our univariable and multivariable logistic regression analysis looking for which patient factors correlated with the incidence of radiation dermatitis. On univariable analysis, we found that morbidly obese patients were more likely to develop dermatitis. Patients treated with regional nodal radiation were also more likely to develop dermatitis, and patients with a large breast volume and larger volume receiving 107% of the prescription dose were more likely to develop radiation dermatitis. Patients undergoing hypofractionated radiation had a lower incidence of dermatitis. On multivariable analysis, the only factor which remained correlated with incidence of dermatitis was breast size with an odds ratio greater than 3. Following the results in the prior slide, we performed a correlation analysis to see which factors correlated with breast size. We found that age was negatively correlated with breast size. Patient BMI and the volume of breast tissue receiving 107% of prescription dose positively correlated with breast size. Here I've provided the results of our logistic regression analysis for radiation esophagitis. We found several factors on univariable analysis correlated with esophagitis, including the regional nodal lymph node irradiation with an odds ratio of 26, as well as a larger amount of breast tissue receiving 107% of prescription dose. However, in multivariable analysis, the only factor which correlated with incidence of esophagitis was the utilization of regional lymph node irradiation. Following from the results of the prior slide, we then did a separate analysis looking specifically at the 96 patients who underwent regional lymph node irradiation, and we found that we looked at the dose to the esophagus. We found that all of the dosimetric parameters we considered positively correlated with the incidence of radiation esophagitis. We then did a separate univariable and multivariable analysis specifically looking on the dosimetric parameters for radiation to the esophagus. And we found that while they all correlated in univariable analysis, the only parameter which nearly correlated with significantly with radiation esophagitis was mean esophageal dose, with a odds ratio of 5.56 and a p-value of 0.057. Moving on to our discussion, here the reported rate of radiation dermatitis of 41% generally falls within the range in the literature, which is highly variable, but ranges from 20 to 70%. Our reported rate is probably slightly lower than several recent studies, possibly due to the large proportion of patients who underwent hypofractionated radiation. Looking at our own institutional patients, our quota rate of 41% is slightly higher than that which we've observed in non-African American patients, where we observe radiation dermatitis in 36% of patients. Previously reported literature in multiracial patient populations have identified that B105, B107, and breast size are all independent factors predisposing patients to radiation dermatitis. Our results here today only find the only independent factor being breast size, which was likely our correlation analysis did show a positive correlation for patients with larger breast size and larger B105 and B107%, as well as patient BMI. So this does agree with a recent study published specifically in patients undergoing hypofractionated radiation treatment. We did also note that patients who underwent hypofractionation or prone positioning for their radiation treatment had a lower incidence of radiation dermatitis, which is similar to recent reports. Here we observed that 16% of patients undergoing regional lymph node irradiation developed radiation esophagitis. This is generally similar to recent reports in the literature. We found that all of the dosimetric parameters we considered were correlated on univariable analysis, but the best predictor on multivariable analysis was the mean esophageal dose. This is consistent with reports from lung cancer patients undergoing radiation treatment to the lung in multiple previously reported studies. We did observe a lower incidence, at least a trend toward lower incidence for older patients undergoing radiation treatment. This is consistent with, again, with recent reports from patients receiving radiation to the lung. To conclude, this is the largest analysis of acute radiation dermatitis and esophagitis in exclusively African American patients receiving adjuvant whole breast radiation treatment. We observed similar rates of dermatitis to what is typically reported in multi-ethnic patient populations, but when compared to our own institutional data, we do observe a slightly higher incidence of dermatitis in African American patients compared to our non-African American patients. We do observe that breast size was an independent predictor of radiation dermatitis, and we observed that mean esophageal dose was the best independent predictor for radiation esophagitis.